The incidence of Clostridium difficile is increasing all around the world, and in some countries like United States is becoming an emergency. This high incidence is mainly related to an abuse of antibiotics, but also to the large use of many other drugs like chemotherapics or immunosuppressive drugs. This high incidence is also related to the emergency of some new strains of Clostridium difficile, like the North American ribotype 027, and also to the resistance of the first-line treatment like metronidazole and vancomycin. The CD-related diseases seems to be related not only to the alteration of microbiota, but also to the host immunity, host innate immunity first of all, and to the underlying chronic condition and treatment. And this new hypothesis, it's also changing the therapeutic approach to Clostridium difficile. All the new treatments for CD are based on the restoration of gut microbiota, like new antibiotics, first of all the fidaxomicin, that has been successfully used in adults and starts to be used and tested in pediatric age. But also the immunological approach with the prevention by using a vaccination and the monoclonal antibodies that are usually targeted to toxin A and toxin B of Clostridium diff. One of the new approach is the fecal microbiota transplantation that is rising up all around the world, first of all, United States. The word of Clostridium difficile in pediatric age is pretty different, and the relevance of the problem is lower, but it's increasing also in Europe and United States for children. In infants, it should be noted that the healthy carriers are usually 30–40% of patients, and so it's very difficult to understand when we are talking about carriers and diseases. However, all these treatments, antibiotics, immunological treatment, and fecal microbiota transplantation, start to be used also in pediatric age.